It's 7:16. News 3 is taking action for your health as the temperatures start to rise during spring. So does pollen. Oh, and that causes big allergy problems for so many of us across the country.
As we take a look at this interactive allergy map, you can see the Midwest has the most allergy problems with high amounts of pollen, according to this map. But Virginia isn't that far behind as we zoom in, seeing the levels at medium to high in our area.
That's enough. We don't want any more. In Norfolk specifically, some of the areas just to our north and west, generally high, which is, that's a recipe for trouble. So we want to bring in our medical expert, Dr. Ryan Light from TPMG at Greenbrier Family Medicine, learning more about allergy season. So we see how these allergies are affecting a lot of us, not just here at home, but across the country. What can we do to try to lessen those symptoms? Aside from move.
Yeah.
Besides moving, obviously you want to stay in and look at the pollen count. So if you have a lot of these allergies, stay out of the pollen when it's really high. You can wear a mask when you're out. Otherwise, the over-the-counter medications, nasal saline. If you're having really severe allergies, allergy shots always help too. So
when we're talking about symptoms, some of the lesser known symptoms for allergy sufferers?
Well, we all know about the runny nose and the sore throat and sometimes the nasal congestion and the itchy, watery eyes. But we also can see a cough with it, hoarseness, change in your voice, poor sleep, leading to fatigue, and sometimes difficulty with concentration from that.
Really? Wow, okay. So what medication should we be focusing on? Because sometimes we see people take them every single day. Is that okay?
Well, when we look at the different medications, there's antihistamines, there's Zyrtec, Claritin, Allegra, that are over the counter there. You also have the nasal steroids, which are one of the most effective ones to use. And then the nasal saline that's out there, decongestants also work. And they are safe to take.
And so that stuff behind the counter that you have to ask for, what's the difference between that and the stuff you can get right off the shelf? Because I never know which one to get.
Well, the one behind the counter is a decongestant.
Okay.
And the reason it's behind the counter is for some other reasons, but we won't talk about those today.
Just making sure I know that I'm getting the right stuff. So when we're taking the medicine, that's safe to take every single day?
Yes, it's safe to take every single day. And you can combine the antihistamine with the nasal steroid with the nasal spray, and you can also use the one behind the counter. But if you are using the decongestant, make sure you talk with your doctor first because it can raise your blood pressure.
Oh, that's very important to know for people who
Yes.
have high blood pressure. Are there alternatives if folks don't want to get medicine from the drugstore?
Well, we can wear that mask, we can move. So those are the big two. Stay out of the high pollen count days. If you're out in that high pollen count, you can actually use the nasal saline or nasal lavage when you come in, so that washes some of that allergen away.
Oh.
And one of the ones that out there that really works is the local honey.
So that does work?
Yeah.
Yes, there's good research on it. So it basically gives you an allergy shot that you're taking every day because the bees collect up all the pollen, so you're exposing yourself in small quantities.
Wow. My husband tried that last year.
You keep preaching about it.
And it works for him. So, listen, some people are suffering so badly. Just try whatever works and see what gets you there.
All of the above.
My family does it every night.
Oh, there we go.
Dr. Light, there you go, straight from the doctor's mouth. It's 7.